Okay, ladies, let's open it up a little bit wider. I mean, what does it signify to you? I mean, the minister brought that up that, the stats are telling us it's going to take over 200 years. I've heard worse than that, actually, in terms of numbers. So that's more of the positive end that I've heard. What does it tell you about the fact that we're here in 2021? What does it tell you about the systems and the structures around us? And is there one thing that you think is tangible we could do right now? Let me come to the minister on that.
Right. That's a great question. And what does it tell us? It tells us that we still have some very archaic systems in place. And quite often, diversity and inclusion is just lip service as opposed to something that is lived and entrenched in systems. So I think the opportunities right now are, first of all, to really understand what we've learned from this pandemic. I said it earlier, women have been disproportionately impacted, and in particular, racialized women have been disproportionately impacted. So there are a lot of lessons to learn in terms of the inequities that we see, even in terms of the COVID numbers. Where did we see the highest numbers in communities? They were essential frontline workers, which are many times comprised of newcomers from different countries. So we have to look at those lessons and get a better understanding of what were the health outcomes there. And how do we make sure that we implement policies in place to ensure that there is more equity in terms of access to health, access to education, access to opportunities? And I know that within my ministry in community and social services, when we're looking at some of our programs that we have in place, that is a piece that I tend to focus on quite a bit, even in terms of how we give out grants to community groups. Like, do we have that equity piece in there to ensure that racialized communities, visible minorities, and other organizations are getting their fair share of what they should be getting in terms of government support? So, there's a lot to unpack here, but I think it all goes back to what are the lessons that we learned from the pandemic? How do we distill those, and how do we take those and overlay them on top of issues around economic recovery? And the gender wage gap, we have talked about it for decades. And you're right, Alberta does have the highest gap as compared to other provinces. And part of that is related to more STEM-related occupations here in Alberta. It's just the nature of our economy. But that begs the question, why are women underrepresented in STEM fields? So there's lots of questions, and we have to unpack all of those and try to put some very concise policies in place as we move forward.
Mm-hmm. Minister, is there a policy that you would love to see? It may just be a discussion point at the table, but is there something that you're like, this is such a tangible thing that we could use in Alberta that would help, especially like you said, racialized women that were more affected by this pandemic than even just general women?
Yeah, I think it's definitely looking at the equity piece, as I'd mentioned in our granting systems within government, but also in training. In my ministry, we've got the income support program that also has a big training component. So people who are already sort of close to the poverty line, particularly women, we need to make sure that they have more customized training available to them so that when they get out into the workforce, they're not just looking at those minimum wage level jobs, they can actually aspire to more. So that's something that we're looking at within the ministry right now as one example.
Yeah, that's great. Let me come to Dr. Mark and ask you about that same question about what do you think of the fact that it's going to take us so long, that we're at 2021 when we're supposed to be all developed and we live in a country like Canada, the US, and yet we're still seeing these numbers, and it's going to take us so long to get to any kind of equity number?
Well, I want to say it's unacceptable. It's demoralizing, it's frustrating. And yet we can't be held back by the numbers. We need to make sure that we're moving forward in terms of having a positive impact on policy, having a positive impact on empowering women to be visible in all sectors of our employment environment. In fact, all sectors of visibility in our societies. I think it's important that we not be daunted by it, that we look back on the successes that have been achieved, and that we stand on the shoulders of many who have done a great deal to move this needle forward, and that we need to keep moving the needle forward. We need to keep promoting appropriate policies and appropriate initiatives in every sector to make sure that women are visible and that women have a voice.
Dr. Mark, is there a policy that you think would help specifically in the gendered ageism issue that you'd love to see instituted across North America?
Absolutely. I mean, I think it's important to look at the reality that our cultures in North America are very youth-oriented. And I think there needs to be a focus on that reality and value age and make sure that women are given the opportunity for career advancement, career development. Very often women who have left the workforce out of necessity because of childcare or elder care have a difficult time getting back into the workforce. And so I think there needs to be a priority for women who are necessarily disproportionately required to leave the workforce because of domestic responsibilities.
Yeah, there's tens of thousands, especially after COVID, that have never gone back because they've become the primary caregiver, in their homes. Dr. King, let me come to you and ask you about that gap and kind of where your head is at when you think of it. At the same time, if there's a policy that you're just like, why can't we get this one thing done?
Yeah, so as the minister and Dr. Mark were talking, I started even thinking about some of the social work issues that we conquered in the field, right, related specifically to domestic violence. And I think far too often that piece of the conversation is missing from the gender pay gap. So there are women that are consistently in abusive relationships and aren't leaving and aren't able to leave due to financial constraints. If we chose to implement policies such as the Pay Fair Act or some other things to put in place to ensure that gap was closed, we could see a decline in those relationships and give women an opportunity to remove themselves from some very abusive and nuanced situations. And today, in terms of what can we do right now, there are people in powerful seats and places in the C-suites in these organizations that don't have women at the table. Put some women voices in the C-suite. Clearly, Minister pointed out that there are all doctors at this table. There are places for us. There are roles that we can hold and maintain due to positions that we have. If we include more women's voices at the table, we can see a decline in that and ensure that we're adding C-suite folks to the table, which automatically is going to increase the pay for those women there. And so that's something automatically that we can do right now. But in addition to that, the policies that they mentioned before are going to be critical to kind of taking it to the next level nationally and kind of impact some of those other things that were mentioned, such as domestic violence.
Dr. King, how do we, if those C-suite, there's opportunities for women to jump into that role, how do you take it as not being just a token?
Yeah. So someone mentioned earlier that performance that happens, right? We just want to make kind of like talk the talk, but not really walk the walk. And it's about accountability. You have to have accountability central to the work that you're doing. In our medical college, we're ensuring that we are not just talking the talk, we're walking the walk, but making sure that there are things in place that will counter anything that violates our diversity, equity, inclusion, and anti-racism work, right? So that means when you notice that the pay is different, when you notice there's no women in the C-suite, that we speak up about it, and not just women speaking up about it, because then there's fear of retaliation, or you're supposed to say that because you are a woman and it's impacting you, right? You have to make sure that not only is accountability central, but that we're all taking a responsibility for making sure that this work gets done. Right. And that it's not just the job of the woman that's at the table. And it's not going to be performative if you continue to add women to the seat. Because patriarchy is still real, people are very much afraid of seeing this all the time. Right. Seeing all of us at the table be experts in our area still in 2021. That's a problem and an issue if we continue to ensure that we bring us into the table. And sometimes that unfortunately means us being the voice all the time for a little while. And I know we get tired of it. I'm sure the women at the seat today are like, we're fighting all the time. It's that sacrifice that we take to ensure that we keep pulling people along with us. I mentor other women and girls so that I can make sure I'm bringing them along and I'm teaching them about the gender pay gap and what to say in these C-suite meetings in order to keep moving the needle forward. So I think it's going to take all of us, and it hopefully is going to take less than 200 and some odd years to make sure that gap gets closed.
That's great. I see everybody nodding their head, so I think you got the whole team on your side on that answer. Dr. Kangon, let me come back to you. I was looking at the stats, for example, in Canada in the last 20 years, and we have narrowed the gender pay gap by $1.04. in 20 years, $1.04. It's mind-boggling. Why in your profession or your line of work do you think it's taking so long?
I think it's taking so long because they don't include women at the table when they're making those decisions. And even when the women are included at the table, if they come up with an idea, sometimes the men take credit for it, sadly. The sooner we can have women's voices heard, the better. Because don't forget, women are nurturing. So if you meet anybody out there who was raised by a strong woman, you can tell from the way they behave. So I think it's so important to always bring women at the table so we can make those decisions. And I wonder why Canada, for example, is taking that long, whereas there are countries like Rwanda that I was so surprised to learn that, after the genocide, sadly, most of the men were killed. And as a result of that, mostly women were left. And now they take about 60% of the government is like the parliament and all that, 60 or 61% is full of women. And so since then, they haven't turned things around. Yes, now they also have men in the parliament, but then those women are there to stay. And so they're closing the gender gap. Same with Iceland, right? So why can't Canada do that? We can learn from countries like that. We can learn from countries like that. We can, there's always something to learn. Yes, there might be a little developing compared to Canada, but I think if they've been able to close that gap, then so can we. Just like Dr. King was saying, that what bothers me also is the domestic violence, right? If you depend on a man, right? If you're not able to go out to work, because most of the time you're doing unpaid work, which is like being a caregiver to the family, to everyone else, and also this word that they call motherhood penalty, like having a baby puts you in a motherhood penalty. I was like, seriously? Because what is that? Like you had a child and now suddenly you're behind because maybe your peers are going ahead. Those who don't have children, they're going ahead in their career, and then they're going to have all the raises in their pay and all that. And medically speaking, as I did mention earlier on with the social determinants of health also, if you are working somewhere and you don't feel adequately compensated, or you come back home and you still have to do the house chores, whereas the man sits in front of the TV, you're going to be stressed out. And with stress, what comes? Like with stress comes mental health crisis. With stress also, I'm just going to speak a little bit biologically, the hormone, which is called cortisol, is released. And when that is released, what happens? Blood pressure goes up, heart rate goes up, inflammation, like inflammatory markers that can lead to chronic disease, all of that goes up. And suddenly we have this person going through, for no reason, they might have chronic fatigue, so they can't perform either at work or at home, which might also lead to fights between partners. It might also lead to things like diabetes. It can lead to obesity, and all that leads to all the other chronic diseases. And so we all, as a society, have to pay for that. Because with all the chronic diseases, what happens now? Canada has to kick in. If you have diabetes and you end up with a kidney transplant, Canada has to pay for that, right? So to me, I think this wage gap difference is, I don't know if I should call it a pandemic. I think it's almost getting to that point whereby the sooner we address it, the better. And we all have a role to play.